suction.
Beautiful. A child is born. A new life begins. For most parents, delivery day is a time of joy and celebration.
That cry is just the most wonderful thing that you hear in the delivery room.
For others, it means tears, fears, even heartache.
I don't know what to think or say or do. Just pray that everything goes well.
This high-risk maternity unit strives to find happy endings to even the toughest cases.
You got a lot of people doing a lot of things. You're gonna be okay.
She's coming. She's coming.
Bringing strength and hope to families facing challenges from the start. At Ohio State University Medical Center in Columbus, 23-year-old Amber Marshall is heading to the OR. Though she looks well, she has faced a terrible loss and could face another.
Right now, they just decided that waiting is playing with fire and they better act on something.
This is an antacid.
Amber is pregnant with identical twins, but early tests showed that they suffered from twin-to-twin transfusion syndrome.
I'm gonna go see if the blood is coming.
What happens is one twin takes all the food from the other twin, to put it bluntly, and that can actually be very dangerous for both, because one gets overfull and distended, and the other one just gets drained completely.
Twin-to-twin transfusion syndrome occurs in 5 to 10% of identical twin pregnancies. Left untreated, both babies could die.
Good. That okay?
Okay, I'm awake.
So 8 weeks ago, doctors clamped the umbilical cord of the weaker twin.
It's not fun waking up every day knowing that there's two babies inside me. One's living and kicking and moving, and I'm enjoying feeling the movement of this little baby inside me, and there's another baby in there that's not alive, and I'm wishing that it was.
It's a tough decision, but they had to sacrifice one of the twins in order to save at least one of them. Because if you had done nothing, she would have lost the whole pregnancy.
Or she'll be completely asleep. I'll wake her up at the end when everything's all done.
Don't forget.
No, don't worry. That's the easy part.
But as the bigger twin began to thrive, another life-threatening situation arose.
So the one twin passed away after they did, and the other one was doing great. But then they were checking levels of a blood clotting factor.
And doctors discovered Amber's blood had lost the ability to clot. Repeated transfusions have failed to help. Doctors now suspect that toxins from the deceased fetus are causing this disorder, and they are now threatening Amber's life.
She would have started bleeding from her gums or bleeding from when she scratched her arm. Very high risk of hemorrhaging and bleeding from any part of her body, which would have been life-threatening to her. The other baby in utero could have died. It had the potential of being very serious.
The decision has been made to operate immediately before Amber begins to bleed uncontrollably. Amber's husband, Jeremy, waits anxiously outside the OR with one overwhelming thought.
Losing my wife and a child, I mean, they're both at risk here. I'm really, really worried. I don't know what to think or say or do, or I just don't know. I got a lot going through my head at the moment. Just pray that everything goes well.
"28-year-old Sarah Lunt is expecting her second child.
They told me that if I walk, that it will help my cervix to dilate more and help the baby to drop lower so that they can break my water sooner and really get labor going. So I'm walking, hoping that I can encourage things along. I'm excited that it's starting to hurt, and that's crazy.
Pain is good.
Husband Darren is by Sarah's side, dressed in scrubs not because he's delivering, but because he's a dental student who ran out midway through a root canal when he learned his wife was in labor.
Left the patient high and dry. Luckily had a friend there that was able to finish it up for me, so the patient wasn't in too much pain. It was the one time I knew if I scheduled that patient it would come, and so it happened.
So I've got the ultrasound machine, so we can check the baby's position, okay?
At first, Sarah's pregnancy was relatively trouble-free.
I think that this whole pregnancy has taught me what a miracle it is to even be pregnant. When you see your first ultrasound and it looks like a little peanut or an alien, and you think that's going to be a baby, you know?
So that's good. The head's down, right where it's supposed to be.
At 30 weeks, Sarah went into preterm labor and was rushed to the hospital.
10 weeks early is just too much. It was just very scary to think of this newborn who would probably fit in the palm of my hand. And what kind of chance would she have? That couldn't be the end of this story. You know, it had to be more. She had to develop more.
Call there.
Sarah knew the challenges a premature baby would face.
She wouldn't have a first birthday like my first daughter did. She wouldn't have the ability to maybe learn at the speed. But I thought the scariest thing for me was just her personally, what she would miss out on. And just to think of her lifetime of what was taken, it just broke my heart.
We had a lot of accelerations with the baby's heartbeat when we did all that, which is good. It just shows that the baby's responding appropriately.
Great, thank you.
Thank you.
Fortunately, a shot of the drug terbutaline stopped her contractions, and Sarah's pregnancy has continued another 9 weeks.
Well, now I am finally admitted to OSU, and we're in the delivery room, and it feels so strange to say how happy I am to be in pain. Keep breathing. I'm dilated to a 5, and my contractions, I believe they're about every 3 minutes apart.
Can I push?
It is a big day. It's one of the most important days that we'll ever see.
Is it a boy or a girl?
Girl.
Mother of 5, Susie Brown, came to OSU after being diagnosed with a rare and life-threatening disorder.
You ever have any heart problems?
Never.
You ever get any chest pain, climbing stairs?
No.
Carrying groceries?
No.
No.
Susie has a condition called placenta percreta. Her placenta has grown into the uterine wall.
The major complication with this is bleeding. Because of the bleeding, you most likely need a blood transfusion.
Okay.
As little as 1 or 2 units to as much as 10 to 12 units of blood. Okay?
Anesthesiology will play a crucial role in Susie's delivery.
Our job is basically to keep her alive during surgery. You know, we put her to sleep, we monitor all her vital functions, you know, her blood pressure, her heart rate, her breathing, her oxygenation. We also monitor how much blood is being lost. If there's any intraoperative emergencies, anything like that, we would deal with those issues. So I'll see you tomorrow morning then.
Okay.
All right.
Thanks for putting me to sleep.
Before you do it. Well, that's what I get paid for, so.
Okay.
But it's after the surgery that Susie faces the greatest danger. She could bleed to death. Susie knows the danger is real.
I had a first cousin who died from bleeding. I guess the doctor they didn't know what was going on with her. But after she delivered, she bled to death. It's been like 2 years ago. And that was her first child. And I was thinking about her.
Susie fears she may not make it out of the OR alive, never to see her children again.
It would have been hard for me because I have 5 and I didn't know who would take care of them. I have my family. They would have. But just leaving them alone without a mom. And to keep them together too. I was worried about them being raised together.
Susie's even talked to her 14-year-old daughter about what might happen.
It was a tough conversation to have, but I had to. I explained to her if there's a chance that her mom wouldn't make it, because she had because she helped out with the younger ones, but to also make sure she stayed in school. Because I want her to go to college. So that's what I had to make sure that she did that. And she said yes.
Well, I'm hoping, praying for both of them to come out of this healthy and strong. And, you know, everyone will be standing around waiting for them, you know. And life goes on. We can live happily ever after.
I'm scared of what's going to happen tomorrow. Thinking and hoping and waiting to wake up.
Sarah Lunt's baby is getting ready to make her big entrance.
She was moving real slow, and then we started the Pitocin, and it seems like now she's all of a sudden taken off on us. I just checked her about 5 minutes ago, and she was 8. We called Dr. Bell, and he's on his way, and now I think she's complete and ready to push. So we're hoping he gets here soon. If not, then I'll deliver the baby.
She's coming.
It's coming? Okay.
She's coming. Oh, oh, oh.
Just let me know when you need to push, okay?
Okay, I need to push.
Okay.
Can I?
Yeah. Go ahead and push. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. That's it.
There you go.
There you go.
Come on, come on, come on.
Hard. Very good, sweetheart. Bring it up, bring it up. That's it. No north, sit on your foot. 5, 6, 7, 8, 9, 10.
Good job.
That's so good.
Let it push. Push. Beautiful job. There's the shoulder. A little push. Nice and steady. There you go. Good job, Sarah. That's it. Beautiful job. And
She's here. She's
there
here.
you go.
She's here.
Oh, take a look at her. Good.
Oh,
Shake her feet like
look
right
at you,
there.
sweetie. Look at you.
Happy birthday.
Oh, happy birthday.
7 pounds, 5.9 ounces. Isn't she cute? Say hello. Oh, she's feeling very nicely. She's nice and pink. She's vigorous. Say hi, Mom.
Oh, there she is. Hi, sweetheart. Look at you. Oh, I'm so excited. It was worth every minute of the pain.
Well, hopefully I'm going to deliver a baby girl. So, I'm a little nervous.
35-year-old Susie Brown has a big morning ahead of her.
Susan Brown, come with me.
That's because this mother of 5 has a rare and dangerous condition called placenta percreta.
And you're not diabetic, is that correct?
That's correct.
Susie's placenta and uterus are so entwined, they cannot be separated. When she delivers, she will also need an immediate hysterectomy.
We would run into issues like dramatic hemorrhage or bleeding, with a possibility of even further complications like infection, damage to other organs that lie around the uterus, and even death. Good. Baby's been moving okay?
Yes.
But everybody's on board. We have a lot of people looking out after you.
Okay.
Susie's first stop this morning is interventional radiology.
It's good to meet you, Dr. Gamboa, one of the radiology attendants.
Okay.
Here, a precautionary surgical measure is being taken.
We're going to be placing this balloon catheter so they can have an easier time during the surgery and decrease the amount of blood in the area.
Doctors will insert tiny balloons in the 2 arteries that supply blood to the uterus.
A little bit of pressure there, Ms. Brown.
After the birth, they can be expanded to block the flow of blood to the uterus.
It could be a life-saving procedure.
But it could also prove harmful to Susie's baby.
And stop breathing there. Don't breathe, don't move. The risks for the baby are the risk of the radiation. We're going to have to irradiate the pelvis of the patient in order to place our devices. We're going to place this next balloon and then secure everything in place. The baby will have a small, very small potential risk in the future of developing leukemias throughout the person's life.
But the risks are small compared to the immediate possibility of Susie bleeding uncontrollably after birth. For now, everything is on track. Susie's blood pressure is stable, and the baby's heart rate looks good.
We're going to the main OR floor now, into Susie's operating room, where we'll have a birth.
4th floor, going up.
Ugh.
Steak.
I'm not hungry, I'm not eating.
18-year-old Tristan Wells has been an insulin-dependent diabetic for close to a decade.
You take a bite. I'm not hungry.
She and Dave are expecting their first child.
Give me a little bit.
Managing Tristan's blood sugar levels during pregnancy has been crucial, both for her health and for her unborn child.
Ms. Wells? Hey. You can check your blood glucose level, if that's okay?
Okay.
How are you feeling right now?
Pretty good.
Good. Blood?
Here in the high-risk unit, Tristan's blood is checked 8 times a day.
The concern with low blood sugars is that a baby can become comatose with a low blood sugar. It also could cause seizures. So that's why we worry.
Okay, 152. Still within the normal limits.
Thanks.
Tristan's been told her child will have a 50% chance of being born with or developing diabetes.
It scares me that if the baby is a diabetic, he's got to take shots. I'll be so scared to give him shots. You have to go through what I went through. And it's not fun, it's painful. I just hope my baby's fine. That's all I'm worried about right now. Still in pain.
2 weeks ago, Tristan went into labor. She was just 26 weeks pregnant and went from 1 to 5 centimeters in a matter of hours. Medication decreased her contractions, and steroids have helped develop her infant's lungs.
Breathe in your nose, close your mouth and breathe in. Blow it out through pursed lips. That gives your baby oxygen as well as you.
But now Tristan's dilated to 7, and there's no turning back.
I'm having the baby today. I'm scared, but I'm having it today. It's a lot early. I was hoping I could carry him longer, but he just wanted to come out.
Amber Marshall must deliver today because she's dangerously ill with a rare blood condition.
You're gonna get real sleepy now. You're off to sleep.
Initially pregnant with twins, one baby passed away in utero.
I'll make sure.
As the twins shared the same placenta, they both had to remain inside until today. So the medical team knows they'll be delivering 2 babies, one breathing, one not. But there are still many other questions that remain unanswered.
Amber has a very interesting case, and I really don't know what's going on here, and I'm hoping we're going to find out. This is one of those medical mysteries I don't run into every day.
Amber's blood won't clot, and doctors think the demised fetus is the cause. If they let the pregnancy continue, allowing the viable twin baby to further develop, they'd be risking Amber's health, a risk they're not prepared to take.
You look at all the information, you make the best decision possible from the information you have, and you pray and hope it's the right decision.
Amber has received large amounts of blood, and there's more standing by.
Because if she's using them up, she'll keep using up what we put in. So I want to wait. As soon as we get the babies out, then Dr. Small will start giving her the other blood products we sent up.
Husband Jeremy has already faced the death of one baby during this pregnancy. Now he risks losing his wife and his still living child.
My wife's in surgery at the moment, and she's at high risk of bleeding. The baby's fine, but pretty early for birth and that, so I don't know what to expect. I don't know how to feel at this point. Everything's just kind of racing through my mind, so I really don't know what to do. I'm really worried.
Thank you. There we go. There we go. Okay. Little girl. She looks good. Here she is.
Here you go.
Thank you very much.
Let's see what's going on with the other town. Good baby.
While neonatologists work on little Chloe Marshall, her demised baby sister, Marissa, is delivered. A sobering moment for all.
It's probably one of the hardest things you'll ever do. We're accustomed to going into a room and delivering a baby that has body tone and is screaming and wiggling and everything else. Even the preemies are wiggling and they have, muscle tone. And to deliver a baby that is not living, it's just limp. It's a very tough emotional situation for any obstetrician. And anyone who doesn't feel that has no business being in this business.
Okay. Now the primary focus must be to safeguard baby Chloe and stabilize Amber.
Whew, there was my sleep for today. I thought I was gonna get some.
At 41 weeks, it's past time for Marthena Morgan's baby to meet the world.
I have one daughter. Her name's Kalila. She's 4. She's in preschool right now, and she's excited to have a brother on the way.
As Marthena's due date came and went, doctors decided to help her labor along.
Well, you induce a patient when she's term and has not spontaneously gone into labor, because going too long after the term date, you would worry that the baby's outgrowing its supply of nutrients. She's beyond her term, so she's ready for induction. And she hasn't had any signs of going into labor for her own, so it's appropriate to go ahead and induce her today.
Very excited. I'll be even more excited if we have a baby by 4.
Does he hear it already?
Yeah, actually.
Because Marthena's baby has been inactive, her doctor is using an instrument called an acoustic stimulator to get him moving.
You got one good movement, he's done.
I think we got his attention.
12 hours into labor, Marthena is progressing again, slowly but surely.
It is just about 10 to 4, and still no baby. So I am now aiming for 6 o'clock.
Sarah Lunt's baby is healthy and alert.
She came right here to the 7th floor, normal newborn nursery. We did normal observation to see how she was doing. She did wonderfully and went right out to her room to be with her mom.
You flexing that toe down there?
After such a great start, the future looks bright for this bright-eyed infant.
We anticipate as she goes home with mom that she will grow up to be a healthy little girl and don't see any problems in her future. I think Kate is having a great start to life.
This is Caitlin Audrey Lunt, and we call her Kate. When she came out, I just felt so good to have all of those scares just go away, all the fears that I had before, and knowing that everything was perfect and she was as healthy as she could be. It's such a relief and just another little miracle that we've had. I feel so amazed that I have a daughter who's so perfect and who came here so perfect. When I think of the other, mothers who've gone through so much and the babies who are, going through major health scares. There are so many babies that I hear about who are struggling or who have even, not been able to make it. And I feel for them and for their mothers so much. It would be really hard. Be really hard. We are very grateful that you're so healthy. And we pray for the other babies, huh? And for their moms.
Yeah, this will be my last child. However,
Marthina Morgan is in the middle of a tough decision.
Nobody's asking you to be a superwoman. We're going to support you no matter what you decide to do. It's just real important for me to know whether you had problems with the epidural the last time, and that's the reason you don't want to do it again, or whether it's just a concern.
I don't know, I'm trying to do this. So we'll see.
This is all negotiable by you. Your decision.
Okay, let's take 5. Just so I can kind of regroup, and we'll know in about 5 minutes.
Okay, so we'll give you 3 more minutes of private time, and that's it.
Okay.
All right.
I have minutes to decide here.
You know how I feel about it, though.
Okay.
Daryl has his own opinion on the matter.
I believe in everything drug-free, so.
Okay, so I had to take drugs to get to this point.
After a short deliberation, Marthina gives in to the persistent pain.
I was thinking no drugs. I've decided on an epidural. And I'm just trying to keep smiling, because once the smile goes away, then someone very different is going to show up.
Miss Morgan, hey. How you doing? All right. That's what I like to hear. Can you just make sure somebody knows that we're getting started in room 4?
This morning, Susie had balloon-tipped catheters inserted into her arteries so doctors can control her bleeding after delivery. Now it's time for her C-section, and hopefully the precautionary measures will work as planned. Her placenta has grown through the uterine wall and attached itself to the uterus.
This is relatively serious surgery with potentially serious complications for both the mother and the baby. And you know, you have 2 patients, so you have to consider what's best for the mother and for the baby.
The most risky time will be following delivery, when Susie's damaged placenta and uterus are taken out. So this OSU team is prepared.
You might have to replace her entire blood volume 2 or 3 times over if there is a lot of bleeding. I think this will be well controlled. You know, we're prepared for the worst, but you know, we hope for the best, and I think things are going to turn out good.
Okay, let's take this up just a little bit more. Give us more space up over. Yeah. That's good, that's good.
Baby's head's right there.
We're about to cut into the uterus.
Dr. Helene, we're about to do uterine. 13. Let's get down first.
Oh, perfect.
Suction.
Second, hold something.
Oh, beautiful, beautiful. All right.
Good.
Yeah.
That's all right, sweetheart.
That's good.
As the OB doctors work on the delicate placenta removal and hysterectomy,
The heart rate was greater than 100.
We have good heart rate.
the NICU team takes over care of Susie's newborn,
Come on, little stinker.
Anaya Monique Carricker.
We're just trying to get the fluid from the uterus outside of her lungs. And she's a little gurgly, and her tone hasn't picked up as much as we'd like yet. We're just kind of stimulating her, giving her a little extra oxygen, and seeing which direction she'll go. There's some chance that she'll need to be intubated if she doesn't pick up, but I think she's going to.
Baby Anaya is struggling, and doctors are about to perform the procedure that could cost Susie her life.
We still have to watch her closely. Unforeseen complications can still arise. And we've done everything that we possibly can up to this point to prevent those.
2 lives now hang in the balance.
Down
your bum. 2, 3.
It's been a long day for Marthina Morgan.
6. Just like that. 7.
Good,
8.
Good job.
9. 10.
Keep going. Got any more left? Come on.
But she's finally pushing.
Keep pushing. Push right through. The head's right there, okay?
Come on, come on, come on, come on, come on.
Come right back. Great. Push through.
The epidural she received a number of hours ago is wearing off, so Marthina's feeling more than she'd like.
That is so painful, I swear.
Okay, come on, let's go.
Big push.
Good.
2,
Keep going,
3,
keep going.
4,
Great push.
5,
However, it won't be much longer now.
8, 9, 10.
But there's a hitch. As Marthina's been pushing, the baby's heart rate has been steadily dropping.
Keep going, keep going, keep
Keep
going.
pushing, keep pushing.
Her doctors are quietly considering how long to allow this to continue before taking the baby by cesarean section.
Come on, push.
Right then, the head appears. Now the problem is clear. The umbilical cord around the baby's neck.
Doing great, head out. You're doing wonderful.
Open up, push down for me. Just like that. Oh. Get this off.
The NICU team takes over during these first critical moments as baby Daryl Jr. struggles for breath.
I'm doing okay. I'm doing okay. I'm just waiting on one good cry.
Just needs to get a few little breaths here. His heart rate's real good.
There you go.
That's what we want you to do. That cry is just the most reassuring, most wonderful thing that you hear in the delivery room. And the louder, the better.
Cry. Now I'll be feeling better.
Daryl Sr. can't hide his emotion over seeing his son for the first time.
Son, I can't even think right now. Huge, look at these.
Susie Brown has been in surgery for 3 hours.
It's a nice pulsating vessel.
What was anticipated as a risky procedure was accomplished with very few complications.
Yeah, so that's the uterus hanging out there. And you can tell that it's not bleeding very much, and I think we can say that's probably due to some of the preoperative things that we did.
Incredibly, Susie hardly bled at all.
I think the balloons definitely had a dramatic impact on the blood loss, and you can tell that as soon as the balloons were blown up. The uterus itself looked not as vascular as it usually does after a normal cesarean section, and in terms of helping with blood loss throughout the procedure, I think it did make a big difference. We actually just took out the uterus, and now we're sewing up the vaginal opening. The uterus, placenta, and cervix have all been taken out. You know, I think we're all very pleased with the outcome thus far. We had a nice, viable, vigorous young female infant that was born healthy. I think it really attributes to the type of care that you have in a center like this, where we have all the help that we had available before the surgery and throughout the surgery to help us have a good outcome.
After a night in intensive care, Susie should wake to some very good news.
She's still going to recover here in the hospital under our close watch. We'll anticipate a quick recovery and home soon with the baby.
Hey, surgery's over. Open your eyes up.
Chloe Marshall is a sick little girl. Born 12 weeks early, she has many symptoms typical of preemies, including a common form of emphysema.
You know, after the way she looked yesterday, we were all really shocked.
It's called interstitial emphysema. It's called air trapping. Air just actually trapped in the middle of tissues, and it just doesn't have anywhere to go. It will move out. It will get better. We just have to support her while that happens.
She has a hole in the heart and a defective valve between her lungs and heart that needs to be surgically closed.
Can she recover? Yes. What do we believe the chances for Chloe to recover and to do very well? I will say at the present time, probably 80 to 90%. No question, she is seriously ill, yet she's very stable.
Once she gets strong.
Chloe's doctors remain cautiously optimistic, even if only for her parents, who are in desperate need of some good news. Now, Mom herself faces a major setback. She has very low oxygen level, and doctors suspect there's a blood clot in her lung.
If the blood clot goes through the blood vessels that go to the lungs, then no blood can pass through there, so you can breathe in and out all the oxygen you want, but it's not going to get to the blood. So that's why it's a life-threatening situation. In fact, it's one of the most common causes of inpatient death in the nation, and it's one of the most common causes of death in post-operative patients. It's something we take extremely seriously.
Amber has been sent to radiology for a CT scan, a type of X-ray that can detect blood clots.
I'm feeling like there's a lot that's happening. Seems like one thing right after the other, so hopefully they'll figure this out. So we're just kind of still at a holding pattern. Seems like she's doing okay, and then I'm not, and then, you know, she's not and I am, and it just keeps going back and forth. So yeah, it has been a tough couple of days. Hopefully it'll be regulating soon.
While Amber waits on her scan results, Chloe is being transported to Children's Hospital, where she'll undergo surgery.
We'll just go little bit by little bit, see how things go. Hopefully tomorrow will go good.
She took something else in the bag. Hello. She's excited about the baby.
Susie Brown's 5 children have much to be grateful for. Their mother survived her surgery, and baby Anaya is improving in the NICU.
Hey, you see your sister?
This is Anaya. Monique.
Baby number?
6.
Despite her precarious medical situation, incredibly, Susie didn't require any blood transfusions during or after delivery.
Her blood loss actually was as well as we could expect. It was closer to what we see in a normal cesarean delivery, regardless of the fact that we did a hysterectomy on top of that.
Yeah.
Baby Anaya's been in the NICU since birth. So Susie's 5 children and extended family have only seen photos of their baby sister. And 2 days later, baby Anaya has made such a rapid recovery, she's ready to go home with Mom and proud Papa Vincent.
We're going home today. We made it. You ready to go home, baby?
After wondering whether she and her baby would survive childbirth, this is a day of quiet celebration.
We made it through. We made it.
Doctors broke Tristan's water a short time ago, and she's been laboring smoothly. But when the baby's heart rate suddenly drops dangerously low, Tristan's doctors are called in.
It came back up, but every time she's having a contraction now, we're getting some pretty deep variables.
Okay.
I think we better just kind of hang tight here. I'm going to put this oxygen on just to help the baby. Okay?
Okay, hon, I'm gonna check your cervix again, and then I'm gonna put a little electrode on the baby's head that we can more accurately measure the heart rate with, okay? We're gonna get the cord and hook this up, okay? Get nervous out, Dave. She's 9. No worries, everything's all right.
The baby's heart rate seems to have leveled out, and just as Tristan breathes a sigh of relief,
We're gonna put your feet up and see if we can push past that little bit of cervix you have left.
she's learning she's complete, and it's time to push.
Now when you have your next contraction, we're gonna push. Are you feeling one right now? Got a big breath. Just push. 2. Come on, big deep breath. 3, 4, 5, 6, 7, 8, 9,
Let it out.
10. Okay.
I want you to use these muscles here to push with, okay? Your chin to your chest. I don't want you to arch your back in the bed, okay? There's an art to pushing. You don't know how to push just because you're a woman and pregnant, okay? Okay, big deep breath on the next one. I want you to hold it in your mouth. I want you to push with your abdomen. And I want you to push. 1, 2, 3, 4. That's good. Keep going. 6, 7, 8, 9, 10. Okay, good.
Tristan is having trouble, and her baby's heart rate is down again, a sign of fetal distress.
Looking a little bit more concerning for the last several minutes. So there is a chance here that we may have to do a cesarean.
Her heart tones were down for too long, and we'll put her on the monitor back there. If they're back up, we can try to push. If not, we're gonna do a C-section.
There's no time to waste.
You got a lot of people doing a lot of things. You're going to be okay. You're going to get a lot more numb than what you have been. This is the oxygen.
So we're trying to get our heart tones here in the OR. Everyone's getting ready to do a C-section though.
You're going to be a mom here in about 3 minutes. You got a name all picked out?
We're going to start.
With the baby's heart rate down for close to 10 minutes, Tristan's doctors must get her baby out, now. The NICU team is ready, well aware they have some serious work ahead of them.
We're just waiting for the baby to arrive, and once we do that, then we're gonna put the breathing tube inside and give her some medicine. Sounds like for the most part that they're concerned for the baby, as are we, so we're just waiting.
A horizontal incision is standard for C-sections, but Tristan's doctors make the split-second decision to cut her belly vertically.
It's faster. Faster, you can move quickly and get less bleeding and get access to the abdomen very quickly.
You gotta feel pushing and pulling.
Baby's almost out, okay?
It feels like it's right there. Where's there?
Yeah, it's just tilted straight down.
A lot of pressure.
There we go.
Outside of
There. How did that? It looks great. Baby looks good.
There we go.
Mom, take a look.
I got 2 grains of antigen.
Hi, Mom, you want to take a peek at this fella?
She got that chair mark, right?
Yes.
Say hello.
Hi, Jacob. Give me a smooch. Big kiss.
That's medicine on his eyes. Give him a smooch, Dad.
You'll get more than that on you before this.
At 3 pounds, 7 ounces, Jacob Earl Wells is quickly transported to the NICU, where he'll spend his first few weeks of life.
Right now we're putting the baby on what's called CPAP, which is continuous airway pressure, so that it allows the baby to breathe easier. We give them the surfactant, it makes their lungs more compliant so they can open easier. And then we give them the continuous airway pressure, and that allows them to breathe easier, and we don't have to use a ventilator. He's old enough, 29 weeks is old enough to breathe on his own. So if we can get away with this CPAP, then it causes a lot less damage down the road.
It went just fine. As best as can be expected under this circumstance. Mom was doing very well. She had no complications as far as emergency surgeries went. It went very smoothly. She had very minimal blood loss. Baby, I hear, had good APGAR scores. From what I understand, it's doing fine for one that's as young and as little as that one is.
Now it's a waiting game to see how baby Jacob bounces back after his dramatic birth.
My name is Daryl Jr. He's officially 2 days old. Some 48 hours. And he's a handful so far. It's a new adventure simply because I already have a girl, so now I have to start all over with the boy. You know, I didn't get peed on the first time around. This time around, he's already peed on me. So, you know, I'm not looking forward to too many more of those diaper changes. All right, adventure's over.
Marthina and her baby are starting their lives together on a very positive note.
He's just like a breath of fresh air, something new. Hopefully, the world will appreciate him as much as I do. Oh, uh-oh, here we go.
This is Chloe Marshall. She's been doing a lot better, more stable, came off a ventilator. Now we're basically just trying to get her on some full feeds and let her grow a little bit.
It's been a rough few weeks for the Marshall family. Following delivery, doctors feared Amber had a blood clot in her lung. Thankfully, it was only inflammation, and now she's doing fine. Then there's Chloe, born 3 months premature. She's suffered lung and heart problems and endured delicate surgery.
Beforehand, she looked like this. She had the large lung, and she had that patent ductus arteriosus there, that PDA. Now the surgeons that went in clipped that for us, and now no blood is flowing across to her lungs. Her heart is working fully 100%, helping her body out. So she's starting to heal even already as we speak.
This tiny baby is unaware that as doctors fought to keep her alive, her mom almost didn't make it, and her twin sister was laid to rest. She certainly had a bumpy start, but Chloe Denise Marshall is one lucky little girl.
Her lungs have improved quite a bit. She doesn't have the pulmonary interstitial emphysema anymore, and she has been gaining weight. She now weighs a little over 2 pounds. I think she's really out of the tough part. She is just through the stage now where we need her to keep growing, get her on some full feeds, and get the IV fluid off of her. But she needs to be about 4 pounds before she'll be ready to go home.
Until then, she'll remain in the NICU, but she's proven she's a fighter, and her parents are confident she'll pull through.
I think she's definitely got some challenges, but if she's as stubborn as us two, I think she'll be very well. So she's definitely going to give them a run for their money.
All the uncertainty, the pain, the fear of a high-risk pregnancy, certainly worth the effort. Once a mother stares into the innocent and remarkable face of her very own special delivery.